All right, and we're back for another episode of We Good. It's the virtual town hall hosted by the African American Leadership Forum. My name is Brittany L Wright, and I'm really excited to be here with you all. Today we are having part two of a two-part conversation about COVID-19 and back to school. Before I get started, on behalf of ALF, I just want to thank all of our sponsors, so the Minneapolis Foundation, North Point Health and Wellness, and Children's Minnesota for coming together to make this town hall possible. And we also want to thank our partners, which includes North Point, Children's Minnesota, Insight News, the Minnesota Spokesman Recorder, and Minnesota Community Care. On today's panel, I am joined by Adrienne Thornton, who is a nurse and infection preventionist at Children's Minnesota. Adrienne, welcome, and thank you for always being here and giving us COVID information. Also joining us, we have Theresa Battle, representing the Burnsville-Eagan-Savage School District 191. Also joining us is Jackie Turner, who is the Chief Operations Officer for St. Paul Public Schools. Also joining us is Demetria Poe, who is a kindergarten teacher for the Osseo School District. And last but certainly not least, we have Stephanie Burrage, who is the interim superintendent for the Robbinsdale School District. Thank you, ladies, for being here and taking time. I know we are in the final hours before school starts. Some of you maybe have already started school, and we're in unprecedented times, right? So I want to thank you for your time, attention, and diligence to be willing to communicate to the community what we can expect for this upcoming school year. And we of course know that this is going to be much more unique than other school years that we've had because we're in a global pandemic. So here to set the scene for us is Miss Adrienne Thornton. Adrienne, can you educate us on where are we at with COVID? Are the numbers looking good? Are they getting worse? How are things going?
Well, they're not looking good. I can tell you that globally, we are at over 22 million cases. That is a lot of COVID circulating across the world. And if you look at the list of countries, unfortunately, the U.S. is in the number one spot with over 5 million cases. And Brazil is next with 3 million cases. And so for us to surpass everyone and have that many cases is quite concerning. Also in the U.S., our death rate is really high. We're up to 169,000 cases of death. And just to kind of put that in perspective for you, we talked last week about COVID moving closer to being the third leading cause of death in the U.S. And we are 66 cases, death cases away from COVID being the third leading cause of death in the United States. That is a problem. If you look at the top 10 diseases that cause death, you have heart disease and cancer. COVID is already the third highest disease causing death in the U.S. So we are not doing good in terms of our control and prevention of COVID transmission. And then for Minnesota, we're doing okay. We're not where we want to be, but we have about 66,000 cases as of this morning, and we have a little over 1,700 deaths. The good news is that we're starting to see a plateau, and we're not seeing as many new cases on a daily rate as we have in the past. So that would indicate to us that perhaps the universal masking within the state is working. Of course, that may change as colleges continue to open up and have students to come back. We will very likely see more cases as a result of that. But just to kind of put our flu death numbers in perspective, I keep hearing people say, oh, it's just like influenza, and, you know, people die from influenza. But as a state, we historically see flu deaths in the hundreds. And for last season to date, we had about 153 deaths related to influenza. And for COVID, we're already at 1,700. That is a huge difference. And COVID has only been monitored since March, and flu we monitor all year long. So that just tells you that COVID is impacting our community at a much higher rate than influenza. And I need everyone to spread the word that this is not just like influenza. You can't compare the two. We don't have an effective treatment for COVID. We don't have a vaccine, and that is some of the biggest differences between COVID-19 and influenza. So you cannot compare the two. This is definitely worse, and we definitely need to keep working to stop transmission.
Thank you for that. So It's still here. It's still happening. It's not getting better.
It's still here.
But we're mid-August at this point. Some schools have already started. Other people are going to be going back to school relatively soon. So what is your recommendation based on the data? As an infection preventionist, do you think it's wise that people primarily do distance learning? I know when COVID first became public knowledge, people were saying it primarily just impacts people with pre-existing conditions or elders. So are you concerned about our younger scholars going back to school?
Oh, definitely. Right now, for the U.S. and for Minnesota, the highest number of cases is occurring in the 20 to 29-year-olds. So our young people are definitely a concern. Even though they have the highest number of cases, the highest number of deaths occurs in people 60 to 69, 70 to 79. And so our older population is dying faster and more from COVID. Our younger people are getting more disease and possibly transmitting it to our older community, which is why we're seeing that higher death rate. So that is a concern. And, you know, going back to school, there is a way to do everything. We have science that shows that if you stick with the 3 W's, wear your mask, wash your hands, and watch your distance, it works. All of that works to stop the transmission, or at least slow the transmission of COVID-19. And so if we are able to employ those methods on a consistent basis, I think whatever program schools use to go back to find either hybrid or, you know, all virtual or in classrooms, but you have to be able to stick to those 3 W's. And so the problem is, for instance, with the colleges, my daughter is a college student, and she went back last week, and I am very blessed that she is staying in an apartment because she was constantly sending me pictures of all the parties that were happening in Ames, Iowa, because all the college students came back. Nobody had on a mask. There was no social distancing at all. And as always, I'm looking for alcohol hand rubs anywhere in the crowd, and I didn't see any. I didn't see any way for them to clean their hands with soap and water. And so the 3 W's were nowhere to be found. And so we know that transmission is going to occur. The first week of school, they had the freshmen come back, and in that first week, they had 66 cases just in that first week with just freshmen coming back to school. And that was before everyone else came back and started with all the off-campus parties. And so having the young people go back to school is a concern because they were already our highest number of cases, and now they're all going to be together and hanging out, partying, and living together. That number of cases is going to increase, and they can possibly transmit it to others, which means that our death rates in our older population is very likely to increase as well. So it is a concern. And really, the 3 W's, I can't emphasize it. If we stick to the 3 W's, we can slow the transmission of this, and people can get back to a semblance of a normal life.
Well, speaking of normal, Osseo School District wanted to have a normal school year over the summer. And so they participated, at least one site had an in-person Freedom School. A lot of other Freedom Schools in the state of Minnesota this year did things virtual, but Ms. Poe, you were a part of Freedom School that happened in person. Can you talk about your experience? Was it normal? Do you feel like it was successful? Did you feel comfortable as an educator being in person with your students? What was that like for you? Uh-oh, we lost you. There we go.
Oh, sorry, you guys. I guess how I really felt about the Freedom School experience this year was that first, it was my first year doing Freedom School, and for it to be in a pandemic, they did try a lot to follow the 3 W's. So the wearing a mask, the washing the hands, and the washing the distance of the kids. So they had fewer kids in each class, and I believe they only had like like 5 or 6 classrooms. And then they couldn't do certain stuff like with their Harambe. They couldn't do that in the morning time coming in. When they did gather in the gym, it had to be like social distance. I guess for me, I feel like it was a good like preview of what's to come for like the school year, because our classroom sizes are way bigger. It's not going to be just 10 kids. Normally a classroom size is 24, at least for kindergarten is 24 for our max. And it just wasn't it wasn't successful. And if that wasn't successful for 6 weeks, you guys, it's really going to be a bumpy ride for the school year. Osseo is doing hybrid. We also are doing AB days. So we're going to have 2 sections of students. And that's going to be very strenuous on the staff and the teachers, just in terms of like trying to keep everyone safe. I don't think it's ideal because Freedom School really showed that even if we do try our best to do the 3 W's, that is really hard with small kids because they naturally want to have that social emotional time. They want to hug you, they want to touch you, they want to hug their friends, they want to touch their friends. And anyone who has worked in a school knows that schools are the most germiest places next to hospitals. And our kids just carry germs. They just germy all the time. And as much as we want to keep them safe and keep masks on, it was a lot of kids that just couldn't. Like the smaller grades, like the kindergartners, had to constantly be reminded to keep their masks on. And I seen them playing with them. I seen them trying to switch their masks or not have their masks. And it's just very hard, as well as like certain things they couldn't do with going outside. They have to switch their outside schedule and their eating schedule, like eating inside the classroom with their teacher, snack inside the classroom. And if that was hard just with Freedom School, it's really going to be difficult when we have a whole building of scholars coming together.
So would your recommendation be to do a completely distance learning model based on what you experienced during Freedom School?
Yes, I would at least say, at least for the first trimester, let's just, just try to figure out a better plan, because I feel like everything's being rushed after the governor has said, it's up to the school districts, and then the school districts have to come up with their own PPE plan and stuff and COVID plan. I just feel like we're rushing a lot, and the first trimester is usually the most where I see kids fall sick the most because of just natural flu season, colds. I don't know, that first trimester is really hard, especially for kindergarten. It's a lot of germs going around, even for the teacher. So I feel like distance learning for the first trimester will be befitting, but distance learning is not also as equitable, especially for the younger kids. Like I have 5 and 6-year-olds who, yes, they do play with tablets and things, but it really is going to take it's going to be a lot of pressure for the parents. A lot of responsibility for the parents until the scholar can learn how to log on and do school online by themselves, which is really hard. So I really don't have the best scenario. I feel we should just throw the whole school year away and try again later. I'm just kidding, y'all. But I feel like distance learning is like genuinely the best way for at least the first couple of months.
Got it. Thank you. I want to pivot to Ms. Stephanie Burrage. Hi, Stephanie. Good morning. Thank you for being here. I saw on the Robbinsdale School District website that there's going to be a Distance Learning Plus model happening. Can you explain what that is and how you guys are moving forward for this upcoming school year?
I sure can. So we have, we met with our families August 3rd through the 7th. We literally, every school principal had to meet with their families, their staff, and students. We then met with our affinity groups, our Somali, our Spanish-speaking families, and our American Indian families, to get feedback from them about what it would look like for us in a distance learning model or in a hybrid model. We heard from all of our groups that if we were in distance learning, they needed supports. Our families needed supports. They needed supports around technology. They needed supports with tutoring. They needed childcare. They needed social emotional support. They needed mental health support. And so that's our Distance Plus model, where we will have sites where families, if they need some in-person type of supports, or our students, then they can then go to a site. They also will be able to do it virtually, where they can get specific supports. We will have our school psychs, our counselors, maybe our cultural and climate specialists that will be available for specific supports for families. We also will have some of our SPED staff available, our special education staff available to help our families. We took the month of July and actually interviewed and connected through surveys and in person, and some, well, not in person, but in calls with our special education families to see what things they would need once we made a decision if we were going to be in distance learning. So we thought for our families, what they requested was that support. Sometimes they need to just come in and say, I need some help, and where do they get that help? And so those sites would allow us an opportunity even to connect with our community partners, so that if there are things outside of the school that the family may need, we can refer them. But that was probably most important for us. I look at it as a beacon of light. People will always come towards a beacon of light, and those sites will be a beacon for our families.
So with those various sites where people can get those additional resources, is that going to be physically in the school, or where will it be placed geographically where those families live? Like if a family doesn't have a car, is there a busing or transportation system? How do people get there?
What we did last year when we did our food service, which was for us, our food service was great. Our families were able to get to the different sites. So we put them the sites around each area in our district so that everyone will have an opportunity to get to that hub. We always do our 2 high schools. We take on 2 middle schools, and then we have multiple elementary schools where those sites are located, so that in each region of our district, we will be able to have service for our families. And yes, they would, if a family needed to get there through transportation options, they would be able to do that.
Got it. I want to pivot now to Miss Turner. For St. Paul Public Schools, you all are doing are you doing full distance learning, or is it a hybrid of in-person and distance?
Thank you. Correct. We are doing full distance learning as we start the school year, and we'll plan to move in phases to eventually get us to hybrid, to eventually hopefully get us to full in-person based on certain metrics that we'll be looking at, as well as monitoring the pandemic itself.
Mitigating some sound issues on my side. So what is the first day of school going to look like for you all? Is it starting right away with learning? Are you grounding in what the pandemic is? Like what can we expect for the first day of school?
Well, in St. Paul, we are doing what we're calling distance learning 2.0. As you all know, we ended the school year in distance learning. So we have taken the summer to improve our systems, make sure that our educators have the appropriate amount of professional development, make sure that our students and families have the necessary technology that they need and supports they need to start the school year. So what that means and what that looks like is that on the first day, our goal is to make sure 100% of our families and students have access to our iPads. St. Paul Public Schools has been in a 1-to-1 district, meaning that our students have been using our iPads for several years, nearly 6. So we were well positioned to support distance learning, and we will continue with that. As we look at our data around distance learning, we have determined as we ended the spring, about 94% of our students were actually accessing their iPad and using their iPad regularly. And about 99% of our students actually were using the iPad over the course of the spring. So we anticipate that our fall, as we move into our fall, that our numbers will mirror those numbers. We're working on right now making sure that our kindergarten, our pre-kindergarten families and students who are new to St. Paul have access to their iPads and to the learning platforms on the very first day of school.
So how are you all planning to mitigate behavioral challenges while this distance learning is happening? You know, if someone has a noisy background because they've got siblings or a parent who's screaming at them, or if they're on camera braiding their hair? Like, what are the rules the same for distance learning as they would be in a regular classroom, or are you recognizing that kids are in their own house and there's a pandemic, and so is it more lax? How does that work in terms of mitigating behavior?
We do recognize that children are in their own home settings, and actually that's not a bad thing. That's actually a good thing. We are taking that opportunity to make sure that we are encouraging and supporting true culturally reflective classroom instruction. We're finding that actually this has given us an opportunity for children to feel sometimes safer and more welcome in their own space. And we've actually seen that some students who may not have been engaged during the regular setting of classroom, that they're actually more engaged now at home, where they feel comfortable and have that supportive network around them. But you asked about how we are mitigating some concerns or things that may pop up or surface throughout the classroom day. We have improved some of our technology platforms to be able to access and provide support for children who may not feel comfortable with their background showing. They may have a number of different people in the household and may not have necessarily a quiet space to always go to. So we're showing and explaining to children how to mute their phone when they're not speaking, or mute the device. We also have certain technology improvements within our platforms to be able to give students an opportunity to create their own emojis, if they will, and show them rather than necessarily their particular background. We're also in understanding, working with our educators to know that based on what you see maybe in someone's household, because it's different than yours, it may not necessarily be putting a child in harm's way. But of course, also keeping in mind that our educators are mandated child reporters, but we are not, that is not our intent, that if we see something different, that it means that it's wrong or bad. It means that it is what it is different. We're also, lastly, working with our students to understand that to use the technology responsibly, and that if we do find that students are using the technology irresponsibly, that we are following our regular student discipline policy, which for us, it has included technology for years because our students have been taking their iPads home. And so we follow our regular discipline policy for students if they are choosing to use the technology inappropriately.
Thank you. I want to ask the same question to Ms. Theresa Battle. How are you all? You all are doing a version of distance learning, or is it a hybrid version?
Well, good morning, everyone. Is it afternoon? Almost. So thank you for this opportunity. So all of the districts are required to offer a distance learning model. And so we have a virtual academy. But to begin the school year, I did recommend to the board that we start with a staggered approach to hybrid, because I really believe we need to educate. We have new health protocols that may be new to students, staff members in the school setting. And so we actually are having 2 extra professional development days at the beginning of the school year. We also will start with our staggered approach with the K-1, starting with conferences on September 10th. And then we're going to stagger in different groups, such as our seniors. So counselors are going to provide appointments in person, mostly outside or virtually, to begin their college planning. And so we're taking a staggered approach to that. As far as the expectations, we have a PBIS framework, which is positive behavior support system. And so just as we want to operate positively in a learning community, we have expectations of how we interact with each other in a community. This is the same expectation. So the 3 W's, so really looking at those health protocols, layering mitigation strategies. So we're taking a staggered approach. We're going to take it slow and then see how everyone really learns those protocols, how our staff and students remain safe. And so really it's how do we go to in-person learning safely? As you heard earlier, there is a way. We've had childcare for our healthcare providers and first responders since March. So for 6 months, we've had about 100 students, infant through 5th grade, in childcare. And so you need to know their parents are strict followers of the health protocols. And so the issue is, how do you take that to scale? And so we've had our Minnesota Department of Health commend us for the health protocols we've implemented in the child care. But as someone else mentioned earlier, I think it was Demetria, the teacher, how do you then take it to scale? So for 6 months, we have had children in our care.
Thank you for that. And how have parents been responding?
So for our virtual academy, we have 2,500 parents who registered their children for the only virtual academy. We also, as Stephanie Burrage mentioned, surveying our parents. And so similar to national and Minnesota parent survey responses, our Black and Latinx families are more concerned about the in-person. So we need to understand this virus has impacted us differently. I mentioned earlier that I am always looking at that because I'm a Black woman and I have an AARP card. And so you only have to tell me once to follow the health protocol. So I'm very cautious about that. We also called every parent of a special ed student in our focus programs, and it's 50% need an in-person because of the negative impact of not having that support, especially for our autistic students. They've regressed, but then 50% of the other parents, they prefer distance learning for various reasons. And so we have to really take all of that in account as we're making these decisions, with health and safety as the first priority.
Thank you for that. You mentioned the seniors, and I'm wondering how close to normal are they going to is their experience going to be? Is there going to be a prom or, you know, senior trips and things? Have you guys even gotten that far yet? Or what do you anticipate the experience will be for folks in their senior year? Oh, you're still on mute.
I'm very encouraged by the class of 2020, our graduates from last year, because they took it seriously, the pandemic, yet they still wanted to have some of those senior opportunities that are very precious. And so at the end of the school year, we actually worked with times for appointments for them to come in with their cap and gown to go on to our football field at Burnsville High School and our alternative high school, an opportunity to take a photo. They even had a little meme of me and the picture of the principal. And so they came in by appointments. Grandparents could stand on the field and parents and take pictures. And so we believe this year we will find a way to have some of those traditional. Now, prom with the social distancing, I think that is similar to a large concert or sporting event, and we all know nationally what's happening with that. So the NBA playoffs started, they're in a bubble, there are no fans. And so the health protocols will guide us for the senior class activities, the class of 2021.
Thank you. I want to go back to Miss Adrienne Thornton. There has been talk about, for people who are doing hybrid versions of education, of possibly, you know, doing the forehead temperature checks as a means for mitigating transmission, or even people who are doing smaller events, they're doing temperature checks at the door. Is that actually an effective way to mitigate COVID transmission, especially given the fact that some people are asymptomatic carriers and may not have a temperature at all? Or is every measure that can possibly be taken a step in the right direction?
Well, you make a good point. A lot of people are asymptomatic, and in our young group of 20 to 29, a fair portion, I want to say about 60% of those patients our people are asymptomatic. And so that means they don't have a fever, they don't have a cough, they don't have a runny nose. And what we're finding out about COVID as we are continuing to learn about it is that the symptoms can manifest in any form or fashion. So we have people who come in and say, oh, I'm nauseated and I've been vomiting and I've had diarrhea for several days, and that's their only symptom, and they have COVID. So taking of the temperature is an okay thing. It's not a mitigation activity in and of itself. It never hurt to do it, but we have to evaluate people for everything. So do you have a temperature? Do you have any respiratory symptoms? Do you have any gastrointestinal symptoms, especially in our younger people, because we're seeing more gastrointestinal upset related to them? Do you have discolored toes? Where we find that some of the kids have discolored toes in their nail beds as a result of COVID. And are you feeling different than you usually feel? I've started to ask people that because, of course, all of my friends and family know that I'm a nurse and they know what I do. And so people are constantly calling me and asking me, should I go get tested? Should I go get tested? And I'm like, well, if you're experiencing any type of symptoms that are outside of your norm and you don't know why, then it would not hurt to get tested, you know. And so taking the temperature is a good first step. It is by far not the only step, and it is just one in a number of things that we should be doing to mitigate COVID-19.
Okay, that definitely makes sense. And I think everyone wants to do as much as they possibly can, right? I'm wondering for Demetria, who works with really young students though, are you talking to your kids about COVID? Is there a plan for how to educate them on why we keep our mask on, what's going on?
For the class that I just had, the scholars I just had, we talked a lot about COVID, but it was over distance learning. Going into this new school year, it is going to be a lot of conversations with the scholars about COVID and why we have to wash our hands, why we have to stay apart, why we have to keep our masks on because we are doing hybrid. So it's going to be, those first few weeks are going to be a lot of just talking about safety, talking about like the expectations of how we would interact in the classroom, because it's going to be very important to get that like nailed down with the kindergarten scholars, because they naturally want to touch everything.
For sure. I'm wondering if it's, have you noticed the like fear within your students? Is it, or is it just something because they are so young that they're not fully able to comprehend beyond, we have to wash our hands and, you know, stay 6 feet away from each other?
Well, with the parents that I have talked to thus far, I haven't really talked to the scholars yet, but with the parents, it is the fear of what's going to happen with their child when they're in the building and how that will look and how we're going to be safe. I'm sure it will be some type of fear with the kids, just because, one, they're entering a new space. A lot of them have not been out of the home. A lot of kindergartners don't all go to preschool or pre-K or even go to childcare. So this might be their first experience out of the home. And then on top of just trying to figure out why they have to wear masks. But I'm very optimistic that the scholars that I am going to get, that at least they know a little bit about COVID with just seeing their parents thus far over the summer, seeing everybody wear masks or having to wear masks themselves when they go to the store and stuff. So they have a little bit of background knowledge of why we have to, but even if they don't, I teach it to them, and we'll just go through all the anxiety and all of the emotions behind wearing it. Because for me myself, I have a hard time wearing my mask too. I'm just be honest, I'm the one that I be having a hard time breathing. My glasses get fogged up, so I be like in the grocery store, like trying to take a quick breath, clear out my glasses and stuff. So even reminding myself and trying to constantly teach myself about the safety as well is going to help them.
For sure. And Adrienne, did you say that there was a specific way that people could wear their masks so that if they are glasses wearers, it's not an issue where they're getting fogged up all day?
Yeah, if you take your mask and once you mold it or put it on your nose, you have to put your glasses on top of the mask. And so, for instance, if you take the top of this mask, your glasses should be right here on top of it, and that prevents that warm air from getting on your glasses, and then they won't fog up as much.
Very important. I know a lot of people are having that issue, and we don't want to give any people excuses to not wear masks, especially when we know that they work, right?
Right.
So we're talking about education and COVID-19, and Robbinsdale, in addition to doing the Distance Learning Plus, also has a virtual academy. Stephanie, can you tell us what exactly that is, or is it the same thing? Oh, you're still on mute.
We always forget to do that.
There we go.
Oh, thank you. I'm unmuting myself here. So in our virtual academy is actually our Robbinsdale Virtual Academy that we started last year. It is a 9 through 12 online program for our high school students, and we offer online courses, but we try to make it so that the kids that are in our online program, it meets their needs. So we have a lot of online projects. We have weekly reflections with the kids. We have quizzes, readings, and assignments that are geared to that online student. So we already had that in place. What we are moving towards now is we will have our distance learning K-12 school, where we will make sure that we meet the needs of those families who are not comfortable to coming back when we are in a hybrid program or hybrid model, and that they will be able to stay in distance learning. For our high school kids that want to participate in our distance learning K-12 school, they will still be connected to their high school. They will work through Edgenuity. But let's say if I'm a kid in AP classes, I don't want to leave my school. We don't want you to leave your school either. So you will then stay with your school, work through Schoology with your teachers at your site, but you will still be connected through the online K-12 online programs. Same for our K-8 distance learning school as well. So we're offering the distance learning K through 12 school for those families who said, you know, it's not safe for us. We just do not want to come back in a hybrid model. We want to stay in our distance learning model, and we wanted to make sure that we had options for them as well. So 2 different programs.
Got it, thank you. Oh, let me make sure I'm not echoing here. Sorry, give me 1 second. There we go. So there's been a big question about equity and making sure that scholars are not falling behind or being disproportionately impacted because of the pandemic and because of the fact that some version of distance learning is possible or is happening. What's the strategy around making sure that we continue to close the achievement gap and support scholars who would traditionally be at risk or maybe struggling academically?
So equity is huge for all of us. And I think we all have a lens to equity. And what we did, so unlike St. Paul, and I think unlike Burnsville, Theresa's district, we were not one-to-one with all of our students. And so when we realized in the spring that we needed to make sure all of our students were one-to-one, we were only one-to-one 4th grade through 12th grade. And so we have now purchased between iPads or Chromebooks for all of our K through 2 students, K through 3, so that we are now walking into the fall that we are online. Everyone. We have one-to-one devices for all, because that was an issue. We saw that as a heavy issue in our district. It wasn't equitable, and we needed to make our shifts, and we needed to put our money to support our students that way. We also then purchased multiple hotspots for families that may not even have access to utilize their Chromebooks and their iPads. So we purchased multiple hotspots for our families as well. And I'm gonna say this, that's why we put our Distance Plus in place, because that is a part of our equity piece to make sure that we're meeting the needs of our families based on their needs, not on what we think their needs. I've also incorporated month-to-month meetings with our affinity groups so that our families do not get missed. We also realized, even in our surveys, all of our families do not send in information through surveys. And so that's why it was a big deal for me to make sure that we could have a conversation with our families and have it through a focus group. So with the surveys and with our face-to-face, and I say face-to-face through Zoom conversations, that we're able to meet the needs of our families. And so that, to me, is about equity. It's listening to our families and staff around what they need to make sure that we're meeting them at their need.
Perfect. Well done. I want to talk now to Ms. Jackie Turner, who again is the Chief Operations Officer at St. Paul Public Schools. I'm wondering about job security during this pandemic. So what happens if the school has to go or the district goes completely online? What then happens with like janitors or school nurses, people who work in the cafeteria? How do when there's like a hybrid model, do they only work a few days a week? Like, how does that work for people whose jobs can't necessarily be done virtually?
Well, thank you for that question. So it's very interesting that there may be an initial belief that staffing would be considerably lower in a hybrid or in a distance learning model, but what we have seen is that staffing and supports just look a lot differently. So we believe that most of our staff will be employed throughout the distance learning and throughout the school year, but what they will be asked to do may look a little differently. We are currently working with our bargaining groups and our unions to come up with agreements and understandings that while I may be a teacher's assistant during the day and normally I would assist that child in the classroom, that you will still be a teacher assistant, but you very well may assist a student in our distance learning academic support centers. You may assist a student and family by helping to get meals out to their homes or supporting them in a curbside setting where they might need technical assistance with their iPad. So there are needs and opportunities for staff who want to work, and realizing that there are some staff also who, because of their underlying health condition, may still need to work from home. So we're trying to accommodate as many staff as we can, realizing that we need to align our staff with the true needs of our students and families based on the current condition that we're all sitting in right now.
Got it. I'm wondering, I know during my time as an educator, there was always an issue with the budget. There's always not enough resources to go around. I was buying my students what they needed in terms of like supplies or just making sure there was extra tissue or whatever I needed for my classroom because it wasn't necessarily always in the school budget. Now, granted, I haven't worked in any of you all's districts, but I'm wondering, how does this impact a district's budget being in a pandemic? Do we go further into a deficit? Does not using the physical space as much, does that help cut down? Like, what does it look like financially to be in a pandemic?
So we have seen all the above. Actually, over last spring, we have seen a huge savings in our electrical and utilities bill because we were not in school. So that we were able to divert those savings to other parts of operations in the facilities and janitorial areas. As you all know, all of us have experienced and are very appreciative of the resources that are coming both from the federal and state level to help support schools, to make sure that we are ready and can accommodate protective personal gear, equipment for both staff as well as students. So the governor has issued supports and physical actual masks for everyone, and what we call PPE, personal and professional equipment, so that our staff can make sure that they are keeping themselves safe in the event that we are person to person when we get to that point. We have also seen our supports go up from our partners. So a number of our community partners are coming in understanding that our school supplies may need to look differently this year, rather than just color crayons and folders, that we are also going to need hand sanitizer and masks. And like you said, Kleenexes and other things to be able to support our classrooms. So our funders, as well as our partner sponsors, have stepped up in that avenue. We are continuing to see different community partners come forth and understand that supporting the school looked differently this year. Backpacks look differently this year. Being able to support students with supports for their technology. Earbuds are now on the back to school list versus maybe in the past it may have been highlighters. But so we are seeing those type of things come up as new equipment, but also seeing our partners step up and saying we're willing to help out.
So I wonder, do you see a potential for learning to potentially permanently be in a virtual realm, or to be more, to exist primarily in a technology space? Or do you think that this is just what's being done because we are in a pandemic? But let's say 5 years from now, when we have our new normal and there's less of a threat of transmission, do you anticipate a more traditional version of school like what we've seen? Or are we now moving towards a more technologically driven education system?
I do see us going into more of a technology driven. I also believe that, as Adrienne has alluded to earlier, that we're going to learn some things as educators out of this. And I hope that we keep those things that are going well. We're going to learn that in certain environments that we can provide high quality education without walls. And that's those students who do better at home or in the comfort of their own environment, but with the use of technology, if they perform better, I hope that we're, as educators, going to be in a position to support them. I also think that we are going to push our educators to get more creative and to do things that engage our students differently or our scholars differently. I'm excited about the number of different technology and data usage that are coming out of this. We're also seeing that 7:30 to 2:30 may not necessarily be the time to have school. That when students are given assignments and they have the freedom and flexibility to work with their families to get those assignments done in their own time, that they actually engagement goes up. So I'm hoping that the pandemic goes away, but we will continue to keep some of those practices and procedures that we have learned to become best practices throughout this current pandemic.
Thank you. I want to ask Theresa Battle. That's Dr. Battle, isn't it?
Yes.
Yes, I'd like to ask Dr. Battle. I want to make sure I get that right. What is being communicated? What is the strategy for communicating about the pandemic? Are you all going to be giving regular updates with school announcements? Are you leaving it to the parents? Are you only giving what's necessary if it's going to indicate a change in a schedule? Like, what is the strategy for how much information you're going to be providing to your scholars?
Well, Brittany, I think communication has been key ever since that Sunday in March when the governor made his announcement. So first and foremost, this is a health pandemic. And so how do we respond in an educational setting? And so I think we would be remiss if we don't mention the role of our school nurses in communication. And so my school nurses, and I have a lead licensed practical nurse, is really at the forefront for education. And so earlier we talked about masks, and so I just want to give an example. So for children, just like adults, we have to learn how to wear the face coverings, and we all have different size faces. And so each school nurse is there to support parents and students, as well as our occupational therapists. And so that's the first communication. So give us the facts, our nurses. What are we getting from Minnesota Department of Health? And so that's first. And then the second layer of communication is how are we responding in the context of our core business of learning and teaching. And so it's that consistent communication. Also making sure staff has information, especially our school principals, because they are relied upon as the tell about their school. And so it's a multi-layered approach with first having our nurses giving that crucial information concerning health and safety.
There we go. Mute button was stuck for a second. So with that being said, do you anticipate having it more within your district? You've already seen some success and figured out some models that seem to be working. Do you anticipate having a more tech-centered education system moving forward? Are there plans to possibly have more classes that rely heavily on like science or health, given we're in a pandemic and we need more people, we need our scholars and people in this world to be more knowledgeable. I'm wondering, what are the long-term implications of being in this moment and how that's gonna shape education moving forward, or at least in your district and the conversations you're having?
Well, I actually hope that there will be a transformation, because as we know, our educational system didn't serve every child well. And so to go back to that normal is not acceptable when you use an equity lens. So yes, we are transforming in many of the ways that Jackie Turner mentioned to you. It's really allowing us to really serve our children in a different way. So innovation, creativity is at the forefront. And I think we have shown we are very creative. We all know we have new COVID skills now. So in 8 days, since the governor's announcement, in 8 days, my district transformed its entire instructional delivery system, support system. We offer childcare to first responders and healthcare workers, and we provided community meals in 8 days. So absolutely, this will transform education. And so some of the things we're doing in our virtual academy, the Distance Learning 2.0, is based on what we learned in the spring, as well as what we learned from this summer. We have to be really focused. We have to differentiate. For example, we can actually provide more tailored, personalized support in a Zoom. So there are breakout rooms. So you can have an occupational therapist come in, a speech language, English language teacher come in right within a Zoom or in that time. And so that's just one example. We all have learned to do things a lot differently as a response to COVID.
Thank you. And how does attendance work? In our conversation about education last week, one of our panelists was a social worker. And so, you know, I'm thinking about child protection services, and they typically get a phone call if a student is truant, if a student has missed too many days of school. But when you're in a virtual setting, how does that apply? Is it if you don't log in by a particular time, you're marked absent? How does it work? How do you do attendance?
So that's one of the learnings that we have from the spring is our parents and our students want a set time. And so we are having synchronous learning. So they will have a set time with their teacher. And so that really helps. And so in the spring, it was if they logged in, if they showed up, you would mark them as present. And so there's going to be a little bit more structure regarding if there are issues. We also have social workers and cultural liaisons for American Indian, Somali, Black, and for our Spanish-speaking families. And so with the social workers and cultural liaisons, they follow up with families if there's a concern. For example, we sometimes find that parents don't know how to navigate the resources. So we partnered with Dakota County for our Spanish-speaking families because they didn't know how to navigate the system. And so all of the technology issues, trying to deal with COVID, with their work, employment, and now the kids are home. And so it was a very successful support between Dakota County, my cultural liaison, and our Spanish-speaking families. So it's really to find out what's happening and then support the family.
Thank you. All right, there we go. Got the sound together. I want to ask Dr. Burrage, I'm curious, how does school lunch work when you're in a hybrid model, or if there's another shutdown and everybody's doing virtual? Like, is there a plan in place to ensure that scholars are eating at home? And what does that look like?
Well, from the information that we've received recently, school lunch will have its same school lunch process like in a normal school year. What was different about the spring, when we were thrown into the crisis mode of COVID, we were able to use our summer school lunch program. So we served in Robbinsdale over 300,000 meals during that time. And that's where we had sites open where families could come to receive meals. So now that we're moving into the school year, it is like our normal school year process, and that students will have to be able to either come to a site. If we're in distance learning, that's what we're still working on. What will that look like for food? Because if they come in for food like they did in the past, instead of everyone just receiving food, they would have to use their number. If they were receiving free or reduced lunch services, then they would of course receive their lunch. But if not, if students were paying for food, they would still have to continue to pay for food just as they would in the normal school year. So we're working on what that will look like site by site, but those are the guidance that we've received through the federal government and through our state as to how we're supposed to service families with food. But we will still have our food service program, and we will serve our families and students with the meal program as outlined by the state and the federal government.
And so then even through a distance learning model, students will have a few classes online, and then there'll just be a lunch break.
Could be a lunch break, and then they're coming into their school during a certain time to get their lunches.
Got it. And I want to ask Miss Adrienne Thornton, we've been talking about the numbers going up, and I'm wondering from your perspective, is there a possibility that districts will be into another shutdown?
You know, it's hard to say. It's hard to dial back into restrictions that we got out of. And so at this point, we know that using distance, watching our distance and wearing our mask is effective to slow the transmission. So I don't know that we need to. If we get to the point where people are not following the masking guidelines, it may move more towards that, but I don't know that our economy or our national infrastructure can handle another total shutdown. I mean, even though that's the best way to completely stop the transmission, the reality is that even if you stop it for a time, once you reopen things back up, transmission is going to occur if we don't follow the guidance. And so I don't foresee us going back to that point in Minnesota or in the U.S. I think at this point we're going to focus on the mitigation efforts that we know that work, which is the 3 W's again: wearing your mask, washing your hands, and watching your distance. And if we can get everyone to do that consistently, we won't need to go back to that complete shutdown state. That was mainly just for us to have time to learn about the disease, what to expect, how to manage it, how to manage people. We've had the time to do that now. We know what to do now to kind of slow the transmission. And so we just need to do it. And we don't really need to go back to a complete shutdown. We just need to follow the guidance.
I feel like the act of mitigating COVID is like the worst group project that society can get thrown in. Like, it doesn't matter if you do your part, because if they don't do their part, right, we're all in a bad position, right? And so yeah. I think, students are learning in real time the challenges of getting everyone to participate. And I think with the upcoming school year, or the existing school year, this is an opportunity to really make sure that our scholars are grounded and educated in those best practices and are getting reminded regularly that this is real, and this does impact more than just you, right?
Right.
And it impacts more than just our health. It's everything from the way that we do our education to the way that we work. I'd like to hear from Ms. Demetria Poe. How does doing a hybrid model impact your workload? Because sometimes you're with your scholars in person, and then other days I'm guessing, at your home, or maybe you'll be teaching from the school. But do you find yourself having to do more work to prepare in a hybrid model, or is it a little bit easier now?
No, it's more work, but it's all about just building a solid foundation, because I will be, teaching the same lesson twice within a week. So I teach my A group, then I teach my B group, and then I teach my A group, I teach my B group, and then on Fridays we'll be virtual. It is a lot of work on the teachers, just preparing and just trying to take curriculum or however you would do your normal activities and making it virtual, as well as just repeating yourself. I feel like I'm preparing myself to be a professor, because I have to repeat myself and do the same lesson over. But all in all, I'm gonna do whatever I need to do in order for every scholar to have that chance and that opportunity to learn, and have that opportunity to get everything that they would get in the classroom, whether it's in the classroom with me or virtual. But it is a lot of behind the scenes stuff. Like, I'm just trying to find new ways to do greetings with the kids, because before I would greet them at the door, they could fist bump, hug, we'll do a little dance, but now I'm just trying to find non-touchy ways to be able to greet the scholars, and just different activities that I did in the spring I'm going to do also on virtual. We would do musical chairs in the classroom. So I found a way, and also one of my coworkers did it, my teammate, Lauren Hoof, she did a virtual musical chair. And I didn't think the kids was going to be happy or excited about it, but they were super geeked. They were super excited to do musical chairs. Everybody just had their own chair, and I just monitored everybody as they went around. And when I stopped the music, they had to stop. So just being more creative and more flexible. I think my younger coworkers and we are more technology advanced and comfortable. So it's taken a lot to teach other team members just how to do Google Classroom or do Google Slides or create a Bitmoji to make things more fun for the virtual side. So it does take a lot of behind the scenes energy, but it's all worth it. We all have been called to educate, and we all have vowed to do whatever it takes, no matter the circumstances, and we're all learning. So the more we show the kids that we're learning and we're trying our best, and we're going to make mistakes and be open and transparent about that, I think it's going to be way easier, this process and this experience. It's scary because you don't know what you don't know, but at the end of the day, we got to do what we got to do.
Right. And you bring up, I think scary is an appropriate word. A lot of people, especially in our conversation from last week, who are working in person in some form or fashion with their scholars, have expressed a level of fear, genuine fear about their health and their safety. And for you, especially working with little people who already may not be practicing the best hand hygiene, or, who love to transmit their germs and overshare. How do you feel in terms of being able to keep yourself safe and keeping your classroom safe? Is it a fear? Do you feel equipped and prepared based on your district strategy? Where do you fall in the spectrum?
I feel like I'm just indifferent. I lean a lot on my faith and not by sight. So just really being prayerful over this school year, because it's just, COVID is just a big deal. So knowing that I'm going to be dealing with these kids and me, myself, I might have an A group, then I have a B group, and then I'm going to be interacting with all these people, all these kids, and we haven't been in these closed spaces together, is a little scary, but I'm just hoping that the district just continues to try their best to do stuff. Like, I know we're all getting face guards, face shields, which was kind of a concern, because how am I supposed to teach letter sounds and my mouth is covered and stuff like that? And they're trying to make sure we have like masks and all the hand sanitizer. I hope they give us the good hand sanitizer, not that new stuff that smell like COVID, because I don't know what's up with that new hand sanitizer, but it smells and I don't like it. And it's just kind of, I don't know, like we have like some routines that we met. Each building has their own way of doing it. At Birch Grove, we talked about like just like the flow of traffic and stuff, and it's already hard to keep them in a straight line. I don't know if they're really gonna be able to stay on the dots, but we're just gonna try our best and really, really like just, it's gonna be reteaching the teachers, reteaching the staff, reteaching the scholars, and just it's gonna test everybody's patience. Like all the teachers that say they got patience, it's gonna test all of that, because it's just reteaching it through and through with this whole safety and the health concern about it. But it is nerve-wracking.
I can imagine so. And you said something important, is really relying on your faith, I think is incredibly important. And then also the communication piece is going to be huge. I'm curious for Miss Jackie Turner, what is being communicated about the risk? So in a hybrid model, are you communicating to parents that there is a risk for potential transmission that could occur? Are you saying, if these practices of the social distancing, the hand hygiene, and all of those things, if they're followed, the mask wearing, that people will not transmit? How are you communicating what the risk is of people being actually together in person?
Mm-hmm. So again, we are in St. Paul, we're starting out in distance learning because we felt that was the safest thing to do right now, and the healthiest thing to do for our students and staff. But as we move into an opportunity, if we can move to hybrid, as we begin to look at our data within the county and specifically within the city of St. Paul, we will be looking more so at our specific data, knowing that our population looks different than a larger county. But as we move to a place where we are able to move into a hybrid option, no, we are not telling staff and students that if you do ABC, you will not come in contact with COVID. I don't think that would be honest. We are following the Minnesota Department of Health guidelines closely, and making sure that staff and students and families understand that we should wear masks at all times, face coverings, that we do have a plan in place for hand washing. We also have a very detailed plan in place for disinfecting and cleaning spaces daily, and then taking that time after each week to even do a more thorough of a cleaning over the weekend as we get prepared for the incoming students coming the next week. We are also making sure that our buildings are equipped with the amount of social distance spaces and signage, so that students and staff understand how they may go in one door and out the other door. All of these things are things that we are doing to model after the Minnesota Department of Health guidelines. Every district has been charged with coming up with a COVID plan. St. Paul, I'm sure, as well as the other districts on the line, have completed that plan and is available for all other families and community to review. We in St. Paul have also recently just incorporated and created what we're calling a COVID database. We actually created an online tool for both our students and staff and families to be able to report if they have come in contact with COVID or if they themselves have been identified positively. So that will go into a database that our health department within the district will then take that information and be able to use contact tracing and communicate with other staff and or students or families that we may need to be able to let them know they have come in contact with COVID. So they are then able to govern themselves accordingly, whether or not they need to quarantine for 10 days or 14 days. We're monitoring that extremely closely. So I think we have taken the appropriate protocols to make sure that we are the safest that we can be. But I think it would be a mistruth to guarantee 100% of the time that students and staff will never come in contact with COVID disease, as we know that we don't know enough about it yet to be able to speak that particular data point. So I think that would be a mistruth to share that with families. And we are also, of course, supporting our students and families, as well as staff that do not feel comfortable in those situations. We've created the distance learning high school, as other districts also have. So the families that don't feel comfortable, when we do move to a hybrid of coming out and participating in in-person learning, that they will also always have the opportunity to distance learn and learn from home.
Thank you. Yeah, and I think that's an important point for me as a parent is I just want to know what is the risk, and if there is a risk, then I would much rather prefer to have the conversation. And I think that's how a lot of parents feel. It's like, let's be clear on what we're doing. And so that the parent, and the scholar can make the informed decision with the information that the district has provided. And I'm curious, let's say the numbers do get a little bit better and you are able to go then to that hybrid model. How does transportation work? I would imagine that you can't do busing the same way that you normally would, or even like carpooling. What do the logistics look like for in the event there's a hybrid model and students need to physically get there?
So thank you. So we, again, are following the guidelines both from the national and federal level as well as local MDH. So the guidelines suggest that we look at 50% max capacity on our buses. And so we have routed everyone out to look at that model with 50%. We are also putting in practice that all students will be wearing masks on the bus as well as the bus driver. Students will sit in accordance, so typically every other seat. And we have the ability to support families sitting together because they're already in their household together. Buses will be loaded from the back first and exited from the front of the bus first. And so that we're preventing as much cover from contact to contact as much as possible. So those are the things that we are implementing. Also, we know that there are going to be a number of families who choose not to take the bus or put their children on the bus, and that is fine as well. In St. Paul, we provide busing for about 22,000 of our students daily during a normal school year. But we anticipate that with the pandemic that some families just are not going to feel comfortable putting their child on the bus. And we are making sure that we are accommodating our drop-off lanes and making sure that we have additional space and staff out in front of schools as students are being dropped off in the morning. So we're making it welcoming or comfortable for if parents want to use a bus, or for those who do not, that there are other avenues and vehicles for them to be able to get their children to school.
Perfect, thank you. I want to pivot to Dr. Battle now and ask, how are you all communicating risk to parents also? Are you erring on the side of caution? You don't want to scare people, but you also don't want to make decisions for them and sugarcoat the reality. So what's the healthy balance for you all in communicating?
So as Jackie has shared, the virus is here. And so it would be disingenuous to say that we would not have any cases. It's not a if, it's a when across our country and the world. And so it's really important to have those mitigation strategies to communicate about that. I think it's also important for people to understand that we're not the enemy. The virus is the enemy. And so we have to continue to work together, collaborate, and problem solve, and be flexible. So at any one time, any district may have to go to a full distance learning. A school may have to go to a full distance learning. And so I've communicated to families to make sure they have child care plans, backup plans, because the virus will lead us to what the model will be based on the cases in our respective counties, other information as well. And so it's that continual communication, but making sure you give the facts about COVID. So at last week's board meeting, our licensed practical nurse, our lead, she began her part of the presentation with the facts about COVID. And so that is standard in all of our communications. And then a follow-up, what happens in our contacts in District 191.
Now I'm wondering, of course, if there is a scholar who goes to grandma's house and they have a barbecue and he contracts COVID. He realizes he has it, he gets tested. He communicates that to a teacher or the principal, someone at the school. How do you communicate the exposure without also giving out someone's now medical information? Like, is there a certain level, how do you also maintain some like privacy and dignity and destigmatize it while being transparent that now this entire class or school has been exposed? Like, what's the protocol on that?
So I'll share the protocol, which is pretty standard based on Minnesota Department of Health and CDC, and Adrienne can fill in where I missed some points. So when it is reported, it immediately goes to either the school nurse, and then it comes to our lead licensed practical nurse, who immediately contacts Dakota County Health, because we have two counties, Scott and Dakota. And then they give us the guidance about the next steps. So they have standard letters. They tell us about who should be communicated to. They do an investigation, which actually leads to the next steps. And so there is a standard protocol that we're following from the Minnesota Department of Health. And I don't know if Adrienne wants to fill in.
Yeah, so the standard process, there is a way to communicate to people without divulging personal information. And for the contact tracing investigation, there are certain guidelines and criteria that you have to meet. So it's not just everyone who was around that child. It was everyone who was around that child when they were symptomatic and not wearing their mask, within 6 feet, and for a certain amount of time. And so what the health department does is they just find out, they start with the question for the person that's positive is, where were you today and the 2 days prior to today when you were symptomatic? Who were you around at that time? And once they find out who they were around, they ask the person, okay, when you were around these people, were you wearing your mask, and were you, within 6 feet, or were you 6 feet away from them? Were you indoors? Were you outdoors? And so there's just a kind of a battery of questions that have to be answered to determine who we actually need to follow up with in terms of exposure risk. And so amazingly, oftentimes the list is not as big as people anticipate, because what we're finding is people are doing much better, with the exception of the young people, but the adults are doing really well with following the guidelines and making our young children, 18 and younger, follow the guidelines. And so we're not having huge numbers of people test positive as a result of an exposure to a young child. And there are studies out there that show that there's transmission from young people to older people, but there aren't a lot. Most children are getting COVID from some adult that they've been in contact with. And so that is reassuring in that there's not a huge concern for transmission from children to adults, but there's not a zero interest. We still monitor it, do the contact tracing, just to be sure, especially for our elderly population. If they're around young children, of course, they are at a higher risk.
Got it. Thank you. I want to pivot to Dr. Burrage as we begin to close out this conversation. Where do we go from here? What is it that you want parents, staff, scholars, anyone who's watching to know as we prepare for a less than traditional school year?
I would love to tell everyone, have grace and space as we work through the opening of school year and as we live through this pandemic. It is challenging for all of us to not function in our normal way of life, of not being able to interact with people. You asked a question earlier about, and I think it was Jackie did a great job in answering, are we going to stay in this space through technology? And I think there are great things that we've learned, but I also do not want to take away from the fact that we need human interaction, and kids do need to connect with their teachers. We as people need to connect with people. So I just think it's give people grace and space to be able to work through all of the changes that we need to make. I'll say again, our teachers and our staff members are doing an amazing job of having to manage changing their style of work and being creative. I mean, I smiled every time, I think it's Demetria spoke. I mean, I was sitting here thinking, in fact, I'm going to tell you, we're right next door to you. So if you ever want to leave your district, you call me, because it was a joy just listening to her speak about the perspective of being in the classroom. And that's really where it's at. She's being creative. Our staff are being creative in how we can educate our children. And so that's what I would leave with people. It's going to be space and grace, and we are all working together. There's not a tax. There are, how do we do this together to make it work and get better for what's best for our kids and our families? So that's what I'd leave with.
Well said, thank you. Dr. Battle, I want to ask you the same question. Where do we go from here, and what do you want to tell, our scholars, parents, and educators who are watching?
So I too was inspired by our teacher here, Demetria. So I applaud you. And so I want to leave us with, Demetria talked about our faith grounding us. I want to leave you with the thought about our elders. So I was fortunate to know my great-grandmother. She lived to be 102. She was born in 1882 and died in 1984. My grandmother, her only child, had 8 children, and 2 died at a very young age due to polio and tuberculosis pandemics. And so as I reflect on that, we have so many more resources available to us. And so our elders, they not only survived, but we are thriving. I have a doctorate in education. I am blessed with wonderful family and friends. And so I want us to ground us that we will get through this, but we have to support each other. We have to be kind. We have to be flexible. We have to be creative. We have to be innovative. And so to thank my staff, community members, parents for last spring. We know how difficult it was in that distance learning. We were all trying to figure this out. And so I want to leave that message that we are in this together, to just keep problem solving, asking your questions, reach out when you need help, family, friends, support systems, be vulnerable, it's okay, but share your expertise and your talents. So I had a high school student, he made 1,000 masks with his friends. I had a staff member, due to underlying health conditions, are supporting staff in different ways, and in the community, and just the whole community has stepped up. So that's my final words to you. So be kind. Remember, we will survive this. We will thrive. Thank you.
Thank you. That's incredibly important to remember. The historical context is this is not the first pandemic that our world has been in. And we are going to get through it. And it may not happen on the timeline that we want. And it may not be, our work may not be as convenient or as simple or normal, but we get to also define what our new normal is. And we also get to reimagine the ways in which we want to connect with one another and the ways in which we want to show up in our work and to create experiences, especially for our young scholars. So with that, I want to pivot to Ms. Demetria Poe. As an educator, as someone who all of the decisions that were made within your district directly impact you, because you're going to be the one in the classroom, regardless of whether or not you got to the table to voice your opinion or if you got to make the final decision. It's impacting you. And then whatever the expectations of the parents are also fall on you. And then the expectations of your scholars, who I would imagine as kindergartners, they don't hold back sharing how they feel. So that's a lot. That's a lot for someone to carry. Please close us out and share from your perspective what it's like to be in that unique intersection and what you hope for moving forward.
Just to be in the middle of that intersection, I feel is just an honor, because I'm in that intersection with our normal life as educators anyways, being an advocate for myself as well as for the scholars, as well as for the parents, and for the district as well. So just advocating constantly that we're going to be okay, that we have to have fun while being flexible, how this is unknown to all of us and we're all going to make mistakes, whether it's the superintendent or the principal or us ourselves as educators, but we just have to continue to remind the families and remind each other that we're a village. And the proverb goes that it takes a village to raise a child. And right now that's prominent more than anything. It's going to take a village for us to really get through this year and be able to move forward in this transformation that we are entering with education. So we just have to, I feel and I hope, I really genuinely hope that as we are exposing the disparities that education already has, especially in Minnesota, with having the opportunity gap, that it exposes the opportunity gap and we don't just stop there with, oh, it's just the technology, or, oh, well, parents don't communicate. Like, we really take these disparities and get very serious about them. And as we're transforming our mind, our spirits, and our practices, and our theology and our pedagogy, on how we just approach education and how we approach our parents and how we view ourselves as educators. We just have to really be transformative and get out of this mindset of we're just trying to get over this to get back to something. We're not getting back to anything. Nothing's going to be normal. Nothing was the same. That's what Drake said. Nothing was the same. So we're moving forward, but we're moving forward in a positive way. And as educators, we have to leave education in a better way than what we had it. So I'm happy to be in this intersection. I'm happy to be here with all of you Black, powerful queens, and having other people who are where I want to be, and also giving me the wisdom, because God said he called the old because y'all are wise, and he called the young because we are strong. So we need each other, whether you're tenured, because I'm still probationary, whether you're tenured, probationary, whether you're superintendent, nurse, teacher aide, we all need each other. We need the families and we need the scholars. So.
Well said. Thank you for that. We appreciate you. I want to pivot now to Ms. Jackie Turner. You've been holding all of the operations, and I would imagine this is probably the craziest logistical moment that you've had to navigate, but you're doing it. So what do you want to leave our audience with?
I want to leave our audience with the fact that, similar to what others have said, we're all interconnected and interdependent. We are going to get through this together, whether you're in a suburban school or in the urban core of our state. You are in a strong educational foundation, a state, and we have a governor who believes in education. We have a supportive healthcare system here, and I think we're doing the right thing. We have to continue down this path. But I know here with my sisters that we are all going to do what our families and students need to be successful. I have no doubt that our children will be okay. Things will look differently, but we will all be okay. And the final thing I want to leave people with is that we also need to, during this pandemic, encourage and get people out to vote, get to the polls on November 3rd. It does make a difference, and it will make a difference.
Thank you. Well said. And I want to close with Ms. Adrienne Thornton. If people are exposed, or they decide they want to get their scholars or the entire family tested, where can people go to get tested and get the information they need on COVID?
So North Point Health and Wellness is continuing to do their testing. You do have to schedule an appointment, but they have appointments available, and you can call them. I have their number.
You got muted somehow, Adrienne. We didn't hear the number. Can you start over with the phone number?
Okay, yes, the number is 612-543-2500. And for people in North Minneapolis, the McKnight Early Childhood and Family Development Center will be hosting a free clinic as well on August 25th. And I don't have that number. I couldn't find it online, but if you contact the McKnight Center, they can set you up with an appointment. If you live anywhere else in the Twin Cities, there are different clinics all over Minnesota. If you go to the Minnesota Department of Health website, they have multiple testing clinics listed on their website, including information about who can get tested and when. And so I highly recommend that you visit that website. You can put your county in that you live in, and it will show you all of the different clinics that are available in your county.
Perfect. Thank you, Adrienne, for always being here and making sure we understand what's going on with COVID and also how to get the resources that we need. And thank you to all of you panelists for investing your time. I know we are down to the wire for most of you. The wire is already here. The moment is here, but you still took an hour and a half in the middle of a workday, in the middle of the week to inform our community. And it really does mean a lot, and we appreciate it. I want to thank everyone for watching and to invite you to come back. Our next conversation is going to happen Wednesday, August 26th. We're going to be broadcasting live from the African American Leadership Forum Facebook page, as well as to the YouTube channel. And that conversation is going to be focused on gun violence and COVID-19. So this will be part 2 of the conversation that we had about 3 weeks ago. And we're going to follow up and continue to address the violence that's happening in our community while being in the middle of a global pandemic. As I wrap up, I just want to say special thanks to all of ALF's sponsors. So the Minneapolis Foundation, North Point Health and Wellness, and Children's Minnesota, as well as our partner organizations, which include North Point, Children's Minnesota, Insight News, the Minnesota Spokesman Recorder, and Minnesota Community Care. My name is Brittany L Wright with Insight News, and it's been an absolute pleasure to share virtual space with you all. And I'll just close reminding all of everyone that's watching that it's no easy moment that we're in. Doesn't be easy for it to be worth the risk or worth the necessary steps to get through it, whether you're choosing to send your scholar to school through a distance model or virtual. All of these decisions that we're making are challenging, and we really do need to come together as a community to support one another and the decisions that we're making, and recognizing as we rely on technology and work towards a more technologically driven education system and world as a whole. We are all operating at different levels of ability within that space, and we also need to support one another and give a tremendous amount of grace and support wherever you can. So be good to yourselves, be good to one another, and we'll see you next time. Thank you guys so much for watching.
Thank you. Be well.